1. What is the most effective nursing intervention to prevent the spread of Clostridioides difficile in hospitalized patients? Answer. Perform hand hygiene using soap and water, not alcohol-based sanitizer. Rationale. C. Difficile spores resist alcohol. Soap and water physically remove them per CDC guidelines, reducing transmission in healthcare settings. 2. What is the first action a nurse should take when caring for a patient with suspected MRSA? Answer. Initiate contact precautions with gown and gloves. Rationale. MRSA spreads via contact. Immediate precautions per CDC prevent cross-contamination before lab confirmation. 3. How should a nurse manage a patient with tuberculosis to prevent airborne transmission? Answer. Place the patient in a negative pressure isolation room. Rationale. Negative pressure rooms contain airborne droplets per CDC, protecting staff and others from TB exposure. 4. What is the priority nursing action to prevent catheter-associated urinary tract infections, CAUTI? Answer. Use aseptic technique during catheter insertion. Rationale. Aseptic insertion prevents bacterial entry per evidence-based practice, reducing CAUTI incidence. 5. How should a nurse clean a blood spill in a patient room? Answer. Use a bleach solution and dispose of materials in a biohazard bag. Rationale. Bleach disinfects bloodborne pathogens per OSHA. Biohazard disposal ensures safe waste management. 6. What is the correct method to perform hand hygiene before a sterile procedure? Answer. Wash hands with soap and water for at least 40 to 60 seconds. Rationale. Thorough hand washing removes transient flora per WHO, establishing a sterile baseline for procedures. 7. What intervention best prevents ventilator-associated pneumonia, VAP, in ICU patients? Answer. Elevate the head of the bed to 30 to 45 degrees. Rationale. Elevation reduces aspiration risk per CDC, a key factor in VAP prevention in ventilated patients. 8. How should a nurse handle a used needle to prevent Sharp's injury? Answer. Dispose of the needle immediately in a Sharp's container. Rationale. Immediate disposal prevents needle stick injuries per OSHA, reducing bloodborne pathogen transmission. 9. What is the appropriate isolation precaution for a patient with influenza? Answer. Implement droplet precautions with a surgical mask. Rationale. Influenza spreads via droplets. Masks and spatial separation per CDC limit transmission. 10. How should a nurse educate a family member about preventing infection during visitation? Answer. Teach proper hand-washing technique before and after visiting. Rationale. Hand hygiene reduces pathogen spread per patient education guidelines, protecting vulnerable patients. 11. What is the first step after a needle stick injury involving a hepatitis B positive patient? Answer. Wash the site with soap and water and report to occupational health. Rationale. Immediate washing reduces viral load per CDC. Reporting initiates prophylaxis like HBIG and vaccine. 12. How should a nurse prepare a sterile field for wound dressing changes? Answer. Wash hands, don sterile gloves, and use sterile drapes. Rationale. This sequence maintains sterility per aseptic technique, preventing wound contamination. 13. What is the priority action to control a central line-associated bloodstream infection, CLABSI? Answer. Remove the central line if infection is confirmed. Rationale. Removal eliminates the infection source per CDC, preventing systemic spread. 14. How should a nurse disinfect a high-touch surface like a bed rail? Answer. Clean with an EPA-approved disinfectant after each use. Rationale. Regular disinfection per CDC reduces pathogen load on high-touch areas, preventing HAIs. 15. What placement is safest for an immunocompromised patient to minimize infection risk? Answer: assign a private room with minimal traffic. Rationale: reduced exposure to pathogens per oncology guidelines protects immunocompromised patients. 16. What should a nurse do if a patient refuses contact precautions for MRSA? Answer: explain the risks and benefits, documenting the refusal. Rationale: education respects autonomy per ethics. Documentation ensures legal compliance and safety planning. 17. How should a nurse delegate cleaning of isolation room equipment? Answer: assign to a trained nursing assistant with proper PPE. Rationale: trained staff with PPE ensure safe cleaning per delegation guidelines, maintaining infection control. 18. What is the recommended vaccination for nurses to prevent pertussis? Answer: administer the TDAP vaccine. Rationale: TDAP protects against pertussis per CDC, safeguarding healthcare workers and patients. 19. How should a nurse manage a surgical patient's risk of surgical site infection, SSI? Answer: ensure preoperative skin antisepsis with chlorhexidine. Rationale: chlorhexidine reduces skin flora per WHO, lowering SSI risk in surgical patients. 20. What is the correct sequence for removing PPE after caring for an isolated patient? Answer: remove gloves, gown, then mask, followed by hand hygiene. Rationale: this order per CDC minimizes contamination risk during PPE removal. 21. How should a nurse respond to a spill of chemotherapy agents? Answer: use a chemo spill kit and wear appropriate PPE. Rationale: chemo spill kits neutralize hazards per OSHA. PPE protects against exposure. 22. What is the best method to prevent C. difficile transmission in a multi-bedroom? Answer: use dedicated patient equipment and enhance cleaning. Rationale: dedicated equipment and thorough cleaning per CDC limits spore spread in shared spaces. 23. How should a nurse assess an elderly patient for infection control needs? Answer: evaluate skin integrity and immunization status. Rationale: aging skin and incomplete immunity increase infection risk per geriatric guidelines. 24. What action prevents cross-contamination when handling soiled linens? Answer: place linens in a leak-proof bag without shaking. Rationale: containment prevents aerosolization per CDC, reducing pathogen spread. 25. How should a nurse educate a patient about hand hygiene post-discharge? Answer: demonstrate washing hands for 40 to 60 seconds with soap. Rationale: hands-on teaching ensures compliance per patient education, preventing reinfection. 26. What is the priority intervention for a patient with a draining wound and suspected infection? Answer: apply contact precautions and notify the healthcare provider. Rationale: precautions prevent spread per CDC, provider notification ensures timely treatment. 27. How should a nurse ensure environmental safety after a patient with VRE is discharged? Answer: disinfect the room with a sporicidal agent. Rationale: VRE requires enhanced disinfection per CDC to eliminate resistant organisms. 28. What should a nurse do if a mask becomes wet during a droplet precaution procedure? Answer: replace the mask immediately with a new one. Rationale: a wet mask loses effectiveness per CDC, increasing transmission risk. 29. How should a nurse handle a patient's soiled dressings to prevent infection? Answer: dispose of dressings in a biohazard container. Rationale: biohazard disposal prevents pathogen spread per OSHA, ensuring safe waste management. 30. What is the first step in managing a healthcare worker exposed to measles? Answer: assess vaccination status and quarantine if unvaccinated. Rationale: vaccination status determines exposure risk per CDC. Quarantine prevents outbreak. 31. How should a nurse prepare for inserting a peripheral 4 to maintain sterility? Answer: perform a surgical hand scrub and use sterile gloves. Rationale: surgical scrub and sterile gloves per aseptic technique prevent 4-related infections. 32. What action best prevents HAIs in a postoperative patient? Answer: monitor for signs of infection and ensure timely wound care. Rationale: early detection and care per evidence-based practice reduce postoperative infection rates. 33. How should a nurse respond to a patient with a cough and fever in the ER? Answer: implement droplet precautions until diagnosis is confirmed. Rationale: droplet precautions per CDC limit spread of potential respiratory infections. 34. What is the correct way to store clean linens in a patient room? Answer: keep linens covered in a clean, dry card away from the floor. Rationale: covered storage prevents contamination per infection control standards. 35. How should a nurse educate a family about visiting an immunocompromised child? Answer: instruct them to wear masks and perform hand hygiene. Rationale: masks and hand hygiene per pediatric guidelines protect vulnerable patients. 36. What is the priority for a nurse after a bloodborne pathogen exposure? Answer: initiate immediate first aid and report to occupational health. Rationale: first aid reduces exposure risk per OSHA. Reporting ensures prophylaxis access. 37. How should a nurse delegate disinfection of a patient's overbed table? Answer: assign to a nursing assistant trained in infection control. Rationale: trained staff ensure proper disinfection per delegation guidelines, maintaining safety. 38. What intervention prevents infection in a patient with a central line? Answer: use chlorhexidine for site care and change dressings as needed. Rationale: chlorhexidine reduces bacterial colonization per CDC, preventing CLABSI. 39. How should a nurse manage a patient's refusal of influenza vaccination? Answer: document the refusal and provide education on benefits. Rationale: respecting autonomy per ethics requires documentation and education per CDC. 40. What is the best practice for disinfecting a stethoscope between patients? Answer: wipe with an alcohol-based disinfectant. Rationale: alcohol-based wipes eliminate pathogens per CDC, preventing cross-contamination.